You are now tuned in to the #1 nursing podcast in the world, the Scrub Me In podcast by Nurse Junior and Anthony.
You are now tuned in to the #1 nursing podcast in the world, the Scrub Me In podcast by Nurse Junior and
Nurse Anthony.
Yes, sir. It's been a while.
Yeah, it's good to be back, baby.
Good to be back, man. How you been?
Yeah, I've been good. The kids are growing. We're all healthy, happy.
Lovely,
we're alive,
lovely.
so we're good, brother. How you been?
Been good. Can't complain, man.
Yeah.
It's been busy, but, just maintaining, trying to thug it out.
Yeah. So for those of y'all that don't know, Junior's in NP school.
Yeah. yes. I'm in
He's
MP
got
school.
placement right now.
I'm in placement. It's rough. I'm in the hood, man. I'm in Detroit. The things I've seen, the things I've heard.
Oh, for sure, man. I can only imagine.
It's wild out there, man. So I guess one story I can share is, and I think I told you about it. We had a teenager that came in, and he had 3 testicles.
Blessings.
He came in and he was like, "Is this normal?" I'm like, no, it's not normal. But I mean, if you're able to do what you do,
Yeah.
you're good. So I mean, so that's the other part of the story. So for y'all that don't know, well, y'all don't know because I'm telling it right now. So he comes into the room. His mom was there as well too. So we had to tell the mom to step aside because I could tell he was kind of nervous, uncomfortable.
What's this guy's background? I didn't
He was
ask
black.
that.
He was black.
Black dude. Okay.
Black dude. And we tell the mom step aside. We'll call you back when we're done. We're asking him questions, and he goes, "Yeah, my friends are telling me how it's not normal to have 3 testicles." And we're like, "Yeah, I mean, you're supposed to only have 2. Are you experiencing any issues, complications?" Like, he goes, No. But we're just having a conversation one day, and I was just confused and lost. So typically, when you're a kid, and it comes to the point where, as parents, you're not really looking, and
For sure.
you know what I mean.
Sure.
And with boys, when it comes down to being potty trained, once we know how to go, we go. We don't need our mom or dad in the bathroom with us.
Absolutely.
So, in terms of assessing your child and feeling it, it's not really
Something
not really on the checklist,
especially not in the teenage years.
Exactly.
Yeah.
But like, he's had it since he was a kid.
Really?
Yeah. So for a parent to just go down there randomly and start feeling, let me see if you have, doesn't make sense. So I can see why it went unnoticed for a while.
Absolutely.
And it comes down to education too. Parents aren't really educating their kids. They're not having that sex talk.
Right.
Basic anatomy. So that's not happening. So with him, like I said, he was having a conversation with his friends, and he realized that it's not normal. So that's why he came in. So my preceptor was like, "All right, pull him down."
He was like, "Oh, what?"
Literally, and I was even like, "Whoa, this is what we got to be doing."
Right to business.
Right to business. So he was kind of nervous, and he pulled it down.
She's like, go assess a junior.
I was shadowing that day, so I wasn't really on the clock. I wasn't banking hours yet. I was just shadowing.
Yeah,
and that was my first, my first shadow segment. Or session. So she did her assessment, and basically all she did was send in a referral for him to go to urology. And that was it.
Yeah.
So that was one interesting thing that I saw, but. Another thing was
so hold on. So where, can you explain the setting that you're in for your placement?
Yeah, it's like a clinic, a primary care clinic.
Okay.
I think we have about 6-7 rooms.
Okay.
And the goal is to see at least, I think every 15 minutes you're seeing a patient.
Right.
Like follow-ups.
Okay.
If it's a new patient that's coming in to the clinic, you have 30 minutes to do your full assessment, document, boom, 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 and then hit the next patient.
Right.
Man, it's a lot of work. It's not
For
doable. It's really not doable.
Because 30 minutes really isn't that long, especially when someone comes in initially. You have that long chat, that consultation. You're getting to learn about them.
Their health history.
Right. And then you have to document, and it's just excess documenting. You're inputting a new patient and all these things.
And it's impossible to document there. I mean, you can document to an extent, but to fully finish, you got to take that home and complete it there. Then you got to get labs, and just a bunch of stuff, bro. But I mean, it's good. I'm loving the process.
Yeah.
I'm like week 6. No, I'm lying. Maybe I'm like week 5.
Yeah.
My week 5, but I'm getting there. And then my next rotation will be pediatrics.
Yeah.
So
It's exciting though,
I'm
man.
excited for that as well too. But other than that, yeah, that's school life right there.
Oh man.
But what was it that I wanted to talk about? Okay, so I will talk about the one story and then we'll transition into the next one. So I think it was second year nursing school, and I think you're aware of the story as well too, where I was on the oncology unit.
Okay.
Andrew's on the same unit as me. This was summertime. I think in the summertime we had to, I think it was like we had to knock down 4 weeks.
Okay.
I don't know how many hours it was, but we had to spend 4 weeks in Windsor.
Okay.
And lock in more hours. So me and her were on the oncology unit, and it was busy as hell. I'm talking call lights ringing.
For sure.
It was just mayhem. So there's this one call light rang. I go in. I'm like, let me just check what they need. Older lady.
Okay.
And she tells me she needs to use the bathroom. I'm like, all right, yeah, miss, I got you. Let me get your walker, put that in front of her, and let's get you up. So, mind you, I'm doing everything perfect. The ergonomics, everything.
Okay.
So I get in front of her, put the walker in front of her. Now I'm beside her, put my arm kind of underneath her arm.
Okay.
And I said, all right, miss, you're going to put your hand on both sides, and you're going to push up. Bro, when she did that, all I heard was a pop. Like a... I'm like, oh, shit. I'm in second year, going into third year. At this point, I'm like, damn. This is it. This is where I get kicked out of the program. I knew it was coming soon.
Yeah.
I'm like, miss, are you okay? She goes, no, my arm is broken. I'm like, oh, my God.
Excuse me? Just from getting up?
Just from getting up. Her
She's
arm's
got
not-
cancer. I can't say nothing.
I mean, yeah, basically. So, bro, I ring the call light. I'm like, I need help. I need assistance. They come in, they run in, take her to wherever they take her. I think they went to go like do scans on her. Bro, I'm feeling bad at this point.
For sure.
I don't even think it reached the middle part of the day right now. So now at the end of every clinical placement, we go in a room and we kind of like debrief.
Yeah.
Talk about anything interesting that happened in the day. And I'm just sitting there like, fuck, I'm done, my life. How am I going to tell my mom? How am I going to tell her I'm out the program?
Back to Rexdale.
Yeah, back to Rexdale. So my instructor at the time goes, Junior, you had an interesting day. How about you tell the group what happened? And I'm looking at her like, miss, this ain't the time. I even think I said that. I'm like, miss, I don't think I can right now. She goes, no. Tell the group. It's okay. So I tell the group, yeah, my patient's arm broke. I'm trying to get her up to the bathroom. Hell, I don't even think she went to the bathroom after that.
No, I'm sure she pissed herself after that. She went to the bathroom.
Yeah,
They make it there.
Facts. So, yeah, I explained that to the group, and then my professor was like, "Yeah, you're gonna have a lot to type about on your journal this week, huh, Junior?" I'm like, "Fuck, more work."
Yeah.
So now I come back the next week, and some of the staff nurses on the oncology unit, one of them comes up to me and goes, "Oh, you're the nurse that broke so and so's arm." I'm like,
Damn, you're that guy.
yeah, and
now.
I'm that guy now. She goes, "Oh, don't feel too bad. Take it as a blessing in a sense." She kind of said it like that. I'm like, why? She goes, well, if you didn't break her arm, we wouldn't have done a scan and we wouldn't have known that her cancer metastasized
to her arm.
to her, to that
Her
area.
bones, yeah.
So in reality, you did a good thing.
Next time, just
Next time I'll let me break another patient's arm. Let's do a scan and see where her cancer metastasized. You know what I mean? Fuck out of here, man. I'm just looking at this lady like, yo, get the hell out of my face. Let me get my hours and go back home to Toronto right now. Like,
that's funny.
I ain't trying to be here.
Oh, that's funny as hell.
Yeah, man. So that's one story. So the second story here that I have, bro, you're gonna be going to be shocked. So the title is Florida Hospital Employee Arrested.
All I needed to know was Florida, and I feel like I already know.
Yeah, Florida's always a thing right now.
Yeah.
But just wait for it. Florida hospital employee arrested for sucking elderly patient's toes.
What?
So picture this, right? You're in the hospital. It's nighttime. Mind you, I haven't read the full article, but I'm just
crazy.
I read parts of it, but I haven't read the full thing. So just picture this.
Okay.
You're in the hospital. It's nighttime. You're kind of confused, but you're still there. You're A&O times 1.5.
Okay.
You know what's going on.
Yeah.
You're sleeping, and you just feel something wet and slimy going in between your toes. And you're like, yo, what the fuck? You wake up, you look, nothing's there. You're like, all right, whatever, okay. Go back to sleep. Close your eyes. You feel that wet, slimy substance again. You wake up again, and you're like, yo, what is going on?
Yeah.
And you see nothing again. So now you're like, all right.
I'm going crazy.
Fuck all this.
Yeah.
I'm going to act as if I'm sleeping, and I'm going to catch whoever's doing whatever they're doing.
Yeah.
Go back to sleep. 10 minutes go by. You feel nothing. So now you start snoring to sell it.
Of course.
And now you feel that wet, slimy substance again. And this time now you peek your eye open, one eye like this. And you see a tech just licking on your toes. Oh, my God.
That's crazy work, bro.
Only in Florida.
That's crazy work.
So let me, I'm assuming that's the basis of the story. So a 23-year-old man who works as a sitter. Okay, he's a sitter. For a Florida hospital is facing charges after getting caught sucking a sleeping patient's toes, according to arrest records. His name is Franz.
Damn, Franz.
Must be German.
Oh, he's something. He's a pervert. He's not a German.
Franz Beldorin was arrested early Tuesday morning for battery on a person 65 years or older.
Holy shit.
The victim, a patient at Gulf Coast Hospital, located in Fort Myers, told the sheriff's office they woke up around 11 p.m. on Monday and felt something touching their foot, according to records. The victim initially thought it was a nurse checking on them, but it happened 2 more times, record shows. The victim told deputies they felt something wet in between their toes during the third incident. When they looked over, the victim said they saw Franz on his knees next to the bed and bent over their foot, according to deputies.
Franz.
The victim said they ripped their foot away from Franz, and he went back to the chair he was previously sitting in.
Bro, come on, G. Go home.
Hospital security called the sheriff's office. The victim reported the incident to a nurse. Blah, blah, blah. Damn, Franz.
Franz the pervert. That's crazy, bro.
Yo, he's up there with that Family Guy character, Herbert the pervert.
Oh, for sure.
He's up there.
For sure. I have a couple questions, though, right?
Yeah.
Franz must have been there like all day, right? Just looking at the patient's feet. Like,
especially if he's a sitter. Like, yeah.
That's crazy, bro. And his most intrusive thoughts won, and he was just like, I need to taste them fucking joints.
Let me taste them bunions. them diabetes feet.
What were you thinking? I would love to fucking know this guy, and I want to know what he's thinking. Because that's crazy, bro.
Man, we got to wait maybe 10 more years when he gets out of prison.
For assault and battery on a 60. Could you imagine rolling up to D Block and they ask you what you're in for?
Oh my God.
You gotta say, I'm sucking some toes.
Wait, what?
What? I was sucking small people's feet.
What did you say?
I was sucking an old woman's toes.
Hey, yo, this guy's sucking an old man's foot. He's a freaky ass dude.
That's crazy, bro.
69 guy.
So I was at a freak off, right? And then,
yo, his life is done.
Yeah, it's done, bro.
You can't do anything else after that.
Oh, that is funny, bro. Oh, man.
Oh, bro. But yeah, anything interesting that worked for you?
For us,
You were
Not
telling me
much.
about that one story about the overweight patient.
Yo, okay, so this was a little while ago. So this is pretty crazy. So it wasn't on our unit. It was on a different unit. But we had this guy in the hospital. When he was admitted, he was 1,100 pounds.
Damn.
Okay? You need to think about that. Like, I'm 300 pounds, bro. That is almost 4 of me. Think about that for a second. And I'm not a small guy. I am not an average guy. He is 4 of an above average guy.
Jeez.
Think about that for a second. Okay? So I don't really know why he was there, but I'm sure we could guess. He was 1,100 pounds. So I don't really know this. Again, I don't know the story of why he was admitted. However, I did hear like some rumors of like his habits at home. And one of them was obviously he's just bedbound.
Right.
And at times, like he'd Uber eat stuff, and it would just come to his window. He'd have to get up, just
right.
his stuff.
This goddamn house is a drive-through.
That's crazy. That's crazy. So that I'm assuming contributed to his weight gain.
Right, right.
So he was originally brought to another hospital. Now, this gentleman was so big that he had to go through a couple things. He can't fit in an ambulance because he's so big. So they have to get firefighters to pick him up. And then when you get to the hospital, you have to think about this. Next time you're in an elevator in a hospital, it always tells you the max capacity of that hospital. I'm not joking.
Yeah.
You have to look up. It's usually somewhere up top.
Yeah. It's usually plated.
Right. Now think about this. The max capacity, at least for us, for like an average elevator.
It's like 12, 13 people.
Yes, but then it'll usually say like 1,500 pounds. Right? So it'll either say the people or the pounds or both together, you know?
Yeah.
When you are 1,100 pounds and Anthony's your nurse, it's only me and you in there, big homie, and nobody else. Like,
I'm going down.
It's just us. And in an old ass hospital like Windsor Regional,
Yeah.
it's just you in there, big homie, because I have not trusted this elevator.
Yeah.
You know what I'm saying? So, because of his weight, they had to send him through the cargo elevator.
Oh.
And it's like a lot bigger, right? The doors open a lot wider and everything.
Yep.
And his bed was a bariatric bed, of course, but like the tubes that came out of the bed, like the air tubes
that were inflating air into
to the bed, because he had to be an air mattress and everything, were like pneumatic, like air tubes. They're like thick and fat, and I was just like, oh my God, like they probably built this bed. I've never seen a bed like this. However, I've never seen a patient that big either, right? And I heard from like other nurses that he was like not being accepted by like bariatric hospitals because he was just too big, non-compliant to like regimens, and they were just like, it's a waste of time.
And most bariatric facilities are outside of, like, Windsor doesn't have a bariatric.
No, this would have been in Toronto. This would have been in
Toronto. So nowhere in Toronto wanted to take him.
No, so he had to come to us.
Can you imagine? Also, how was it cleaning him up?
So this is the thing. So this is how I had met this gentleman. Like, again, he was never a patient of mine. He was so big that we had to have like a total of 10 staff members there just to roll him, because one, he needed to be rolled to be cleaned up.
Right.
He's got wounds, because I'm sure they're like bed sores and all this stuff.
100%.
So he's got wounds that have to be done every day. However, if you take 10 staff members from your unit, that is your whole unit just in this guy's room for X amount of time. Now, we were in there for like a half hour. So for a half hour, if you had everyone from your unit, you wouldn't be available to the rest of the 30 to 60 patients you have on your unit.
So if a cold's happening, they're toast.
They're dead. So what they had to do was literally get 1 or 2 staff members from every floor That way, at least every unit still had some coverage, and then you still have your 10 staff members for this patient. Wow. So, man, so I remember, so it was like 7 or 8 staff from different floors. We had the nurse that had this patient for the night. We had our after hours manager in there to help. We had like a couple unit aides in there. One was from my unit. So it was me from my unit and our unit aide. And then the others was from different units. So, man, honestly, we rolled this guy over. I had a mask on, but the smell that came out from this guy.
It's them folds, man.
Holy shit. Yo, honestly, so he rolled away from me, and I was just like,
the wind.
I had to turn, like, I think if he looked at me, even through the mask, he would have been, like, embarrassed. Like, it was, like, horrible smelling, bro.
So, like, how was it? I'm trying to figure it out, because typically, was this the night shift or the day shift?
So we were a night shift, but it was around, like, 5 in the morning.
So every morning, 5 a.m.
5 a.m.
Avengers would come down and just handle this shit.
We come down, we do his, I'm assuming he probably had, like, multiple dressing changes for the day, but we changed his dressings. We pretty much, like, did, like, a little mini bed bath, cleaned him up, changed his bed sheets, get all that done for him. Now he's ready for the day at 5 a.m. Because even though you have more staff on days, it's just so fast paced that you don't really have time to do all this, right? Yeah. And we, like, when turning him, you needed to turn him to do his wounds. So imagine you don't have time and you're pulling all the staff away just to turn this guy over. He was a big dude, bro. However, now when I had, like, met him the couple times that I went to help, was very early in his hospital stay. I heard he was there for a while. And I heard he lost like 300-400 pounds just because we're not going to supply you what you're eating at home.
Yeah, no Uber Eats.
No Uber Eats are rolling up to your window like a drive-thru.
Yeah.
Like, you're not eating all this junk food. Now, don't get me wrong, hospital food isn't great, but we still provide 3 meals a day. So I'm sure he's eating his 3 meals a day, and his caloric intake is a 20th of what he's having at home, right? Because he's not getting up to exercise. He's still staying in that bed, and for you to lose like 300 pounds in a couple months means the deficit that you're in is crazy compared to what you were at home.
100%.
So yeah. So I heard he lost a ton of weight before he left, like crazy amounts.
Wow. So they sent him back to pretty much his hometown, or
I have no idea. I honestly have no idea around his discharge. Again, he wasn't on our unit, but maybe he went to rehab, help him get up, start moving if he's eating well, some sort. Maybe the bariatric facility accepted him once he dropped some weight. I don't know.
So it leads me into the next story that I found online about a 450-pound woman. It's kind of similar to the situation. Obviously, she wasn't weighing 1,000 pounds.
People need to think about this for a second. Like, even like just 450 is an immense amount of weight.
It is.
Like, that is a whole other person on top of me in one body. Think about that.
Bro, it's a lot.
You know what I'm saying?
It's a lot.
So now this guy is more than double this person you're talking about. You know what I'm saying?
Damn.
Like,
so,
it's insane.
This person is not, okay, so not a nurse. This is how the story goes. Not a nurse. But my mom was a charge nurse in the ER when they got a call that the paramedics were bringing in a 450-pound woman who hadn't left her couch in years. Years. God.
Oh, you know what? Mm-hmm. Well, you know how I talked about turning that guy and the smell came out? Yeah. Imagine standing this woman up and you'd be like, oh my God.
That's what I'm saying.
Like, crazy.
She's urinating, pooping in the same spot.
Oh.
Like, she just doesn't have the ability, the strength to get up and walk to the bathroom.
Yeah.
I don't even know how you can go for that long and not be able to, like, just be mobile and use the bathroom.
Bro, I can't imagine.
Oh, they were bringing the couch too. So yeah, so we're bringing in a 450-pound woman who hadn't left her couch in years. Oh, they were bringing the couch too. The woman had spent so long on the couch that her skin had grown into it and was also cemented with body waste. They had to cut the couch.
Cemented with body waste.
I loved how she used that.
Holy
cemented
crap.
With body waste. They had to cut the couch small enough to fit through the sliding doors, put 2x4s under the couch to carry her out, then load the couch and her on a trailer to drive her to the hospital. She couldn't even fit in the ambulance.
Oh, this is what I'm saying, bro. These big people can't fit in the ambulance, and then fire stations got to come and help them out.
Yeah. So they had to rent a U-Haul truck, basically.
It's fucking crazy. Can
Insane.
you imagine?
On a trailer to drive her to the hospital. They couldn't bring her into the ER without causing a biohazard. So they had to try to stabilize and treat her in the parking lot. After donning full protective gear and respirators, being morbidly obese and suffering from emphysema or asthma, and probably a host of other illnesses, the poor woman died in the parking lot. I guess the stress of being driven through town on a trailer in the middle of the night didn't help either. The worst part, her family was aware of her condition and was bringing her food on a regular basis, but never bothered with anything else. And there's a link on it too, but yeah, 480-pound woman dies after 6 years on a couch.
Damn it.
6 years.
That's a long time, bro.
My God.
Bro, that's a long time. My kids aren't even 6. That's crazy. You spent more
Bro, I
time
can't even imagine. You spent
insane.
6 years of your life in the living room just watching Simpson reruns. That's crazy.
That's crazy, bro.
I can't even imagine.
See,
man.
now, these things make me wonder, though, right? Like, okay, unfortunately, RIP to this lady. She passed away.
Yep.
So it makes me wonder, does her family, like, sue the hospital or sue?
They can't,
because
man.
I have questions.
They're part of the problem.
This is just my personal opinion. Now, I'm sure a lot of people won't agree with this. And this is maybe something that could be talked about in comments and stuff. But my opinion is, and I kind of mentioned this to you the other day, but my opinion is a lot of people don't really want to do what needs to be done to put their health in the right order, or to really take care of themselves health-wise.
Right. Put their health first.
I think not that people don't want to, but people don't want to put the work in that it
Yes.
takes. You know what I'm saying? Because I look at a woman like this, or the 1,100-pound guy, or people with diabetes, and what leads with diabetes and all these things, and they come to physicians and they get their medication and things don't work, and then they sue. Something happens and they sue. This happens and they sue. And then it just becomes, bro, if you honestly went for a walk like 2-3 days a week, watched your diet, you wouldn't have diabetes. Yep. You wouldn't have heart disease. You wouldn't be an end-stage kidney disease. You wouldn't have all these host of problems. And that's not to say there aren't congenital issues. Of course there are. However, the majority of the things we see in hospital and in a clinical setting are very much avoidable.
100%.
You know what I'm saying? So this woman that was cemented into her chair, I'm sure in the early stages of those 6 years, if she just got up, honestly, if she got up and went for a walk like 3 days a week and came back to her chair, I'm sure that a lot of this could have been avoided.
Easily. It's tough because now I think, was she just non-compliant? She one of those individuals that just didn't listen to her family and her healthcare provider. Maybe some mental health issues there as well, too.
I'm sure.
Who knows?
I'm sure.
But you're completely right.
Because I even see, like, as an example, we have vascular patients on our unit all the time. And a lot of their issues come from smoking. Now, they're here with packing wounds and in odd places because they just can't cut the habit. And I know this is a hard example because I understand smoking is an addiction and all these things. But you're getting limbs amputated and all these things, and the only thing you can think about is going outside to smoke. And I'm just like, yo, go for a walk. Stop smoking. Go for a walk, bro, and your neuropathy will improve.
100%.
Like,
bro.
Yo,
it's funny you bring up smoking. I had a patient, actually, and this was crazy enough. This was in Alaska.
Yeah.
He got some type of bedside procedure with like some local anesthetic, something with his foot. But I guess he had a wound on his foot. They numbed it, did what they had to do, wrapped it up. Mind, this guy's like maybe in his 500 pounds, Samoan guy.
Yeah.
Big dude.
Big boys.
Big dude, man.
Big boys.
Big dude. So doctor leaves. I get report. Boom, boom, boom. Hey, sir, what's up? My name's Junior. How you doing? Can I help you with anything? Yeah, I want to go out and smoke. I'm like, yeah, we can't do that. You can't smoke outside. And on top of this, it's like minus 30. I ain't going outside to help
You better crawl out there, big homie.
That's what I'm saying. So here's the thing. He goes, if you're not going to take me outside to smoke and you're saying that I'm not allowed to smoke, then I guess I'm just going to stand up and go on my own and go smoke. I'm like, how are you going to do that? Watch me. So he literally gets up and he's hopping on. I'm like, yo, chill. Sit down. Let me get the charge nurse. She's going to come in, talk to you, and we'll see what we can do. I go to my charger, so I'm like, yo, charge nurse, listen. You got to talk to this guy. He's trying to get out of bed. He wants to smoke. I told him he can't. I did my education, blah, blah, blah. Told him why. You know, it's gonna slow down the healing process on the wound if you smoke. All nurse and shit. She goes, yeah, let me go in there. Let me talk to him. She goes in, talks to him. She can't get through to this man. To the point where now the charge nurse now has to call the doctor and tell the doctor what's going on. We call the doctor. We tell the situation. She goes, go let him smoke. Let him go outside and smoke. Make him sign it's like a release form where it's like it's kind of like an AMA form, but for smoking.
Okay.
I'm like, you got to be kidding me.
Yeah.
It's minus 30. You want me to go put on my jacket, put on my snow boot? Like, I'm talking it's full out blizzard outside.
Right. It's Alaska.
It's Alaska. It's Alaska. I'm like, God damn.
Oh, man.
So I'm in my Canada Goose jacket zipped up, and I'm in a wheelchair wheeling him out, and
you
I'm
are
there.
a better man than me. Ain't no fucking way.
Bro, I was his primary nurse, so I had no choice. I'm out there cold, and he's just there smoking. So where are you from? I'm like, yo,
nigga, Africa,
yeah,
where it's warm. Yeah. Hurry up and
no
get your ass
cap. Like,
inside.
yeah, finish up your cigarette, man. Let's get inside. Pull the shit. Bro, I shit you not. He smoked at least 5 cigarettes within. Bro, it must have been within the 7 minutes.
Bro, that's insane.
Like, that's how quick he was going.
That's crazy work.
And in that time frame, a car pulls up. A man comes out, and he goes, yeah, is your name so-and-so? He goes, yeah, that's my name. The guy now goes to the back of the truck. He pulled out a pizza. This man somehow ordered a pizza throughout the whole process of me getting the charge nurse, calling the doctor to tell her about him, how he wants to smoke. How did he have time to order a pizza throughout this whole process?
Nigga, where there's a will, there's a way.
Not even that. What I say is, when there's a Will, there's a Smith. Oh, and this guy, if there's a Will, there's a Smith. Because goddamn, this guy ordered a pizza.
That's crazy.
Ordered a pizza, smoked 7. Oh my god.
Yo, this guy did not care, bro.
Bro, I wheeled him back in with the pizza in his lap. I get him back situated in the bed, and he goes, "You want a slice?" Nah, I don't want a slice. I'm gonna go get some warmth.
I'm gonna find a space heater.
Yeah. Fuck out of here with that.
Oh man.
And when you let a patient do that once, they're gonna want to do it
that's
again.
Pandora's box, right there.
Pandora's box.
Oh my god.
At that point, I told the chargers, yeah, we need to split it now. I ain't going the next time.
That's exactly right.
I'm not trying to catch pneumonia.
Yeah, y'all open this box.
Yeah,
I'm out.
There's no way in hell I'm going out there
we actually
again.
have a doctor like on our unit that, let's say, especially he's a vascular surgeon as well, and if you're doing things that he deems is the cause of your problems, and he's telling you to stop and you don't want to do it, he's like, yo, sign this paper, bro, you can go find yourself another surgeon. He's real. Like, I'm out. I'm not doing this with you. I'm not part of this.
It's a risk.
I'm not putting my name and putting hard work into something that is just inevitably going to end horribly. Yeah, and here's the thing. Most people do, but this is like, yo, you're being too blatant. You're being too much. I'm working hard to get you to feel better, and you are counteracting everything I'm doing.
Yes.
You know what I'm saying? So he's just like, yo, sign this paper, find another physician.
Going through one ear and out the other.
Absolutely.
It's like we're wasting our time.
Absolutely.
Like, at this point, it's like, all right, you might as well just go home.
I couldn't agree more.
Let's discharge.
Now, don't get me wrong. Like, for me, if I have a patient that isn't there for these issues. Like, it's not related to their smoking and they want to go smoke and they need help, I'll bring them out. I don't care. If I have time, I'll do it. Not in the middle of winter, but I'll do it. But when I have a patient that this is why you're here, I am not going to bring you out to make this worse.
Yeah.
Because when you're just having difficulty breathing, and now I'm the one that's got to take care of that.
Right.
You know what I'm saying? Like, you're in respiratory distress, I got to take care of that. And I'm not doing that because you wanted to go out and have a smoke. Here's a nicotine patch. Good day, sir.
Facts.
Yo.
But with this guy, he was just non-compliant. He did not care.
Yo, honestly, bro, I would have been like, yo, hop your little ass outside. Not little, he's bigger than me.
He's big as hell.
Hop your big ass outside. I ain't taking you out there.
Oh, man. Probably one of the worst nights, honestly.
Yo, and I'll pretend like I don't see him.
And the crazy thing, bro, is like it's a small town.
Yeah.
Where I was at in Alaska. So rumor got around that, so you let so and so smoke. Where's the form? I want to sign the form.
Give me the form.
So now it's like when you're educating someone about smoking and how you can't smoke, automatically they bring up, well, there's a form.
Absolutely.
I need the form.
Absolutely.
Let me sign the form, or let me talk to the doctor so I can get the form.
Right.
God damn, who did you talk to?
Right. Word of mouth, bro.
Word gets around quick.
Because I'm sure someone was like, yo, where'd you get that pizza from?
Yeah.
Why do you smell like a cigarette, bro?
Yeah.
What's going on here?
Yeah, what's going on?
And then he tells him, yo, they got this form up in this bitch.
Yeah, man.
The Nurse Junior got you.
Yeah. The black nurse.
Yeah.
Make sure you get the black nurse.
Yeah,
He's the one that took me out to smoke.
That's exactly right.
He'll wheelchair you out.
He'll do it.
He'll let you take a hit.
Nah, bro, not me, G.
Nah, man. It was fucking nuts.
That's crazy.
Another crazy story in Alaska. It was a smaller village. So the town that I was in, there's like 5 surrounding villages around it.
Okay.
And there was one village, I guess one individual was hunting. He had a harpoon. I don't know if I told you the story.
You've never, but I'm not surprised. You got to have these things in those places, though.
You do. But he was hunting, I don't know if he was hunting seal or hunting deer, I don't know, or elk, whatever.
Mm-hmm.
Had the target, click the trigger, it didn't go. He's like, yo, what the hell?
Scared.
Let's go. Clicked it again, nothing. So now he's assessing the harpoon, the mechanism, trying to figure out why it hasn't, So now he turns it.
Oh no!
And now he's pointing it in his face, right in the eye.
Oh my God,
bro! This guy comes in, harpoon through the goddamn eye socket.
Oh my God!
I thought he was gonna die,
bro. That is insane. How did he not?
We had to transfer him to another facility because we're in that facility. We're a small facility. We don't have the resources to treat certain situations, or we don't even do surgeries
right
at that facility. So we had to send him to Anchorage, which is like the bigger city.
How do you even stabilize that for transport? Is what I want to know.
Man, I don't even know what they did. I kind of just walked through. I wasn't even in the ER that day. I was in another unit. But I peeked my head through, and I'm like, oh, hell no. This guy may not make it. But
bro.
Apparently he did, man. Now they call him One Eye.
Oh, for sure. Oh, man. So, yo, I'm the worst human being on the planet. So, we had, this just reminds me of a story. We had a nurse on our unit. Mm-hmm. And she's gonna know who I'm talking about because she watches
Come on the show.
So, yo, she unfortunately got, I guess, like, bit on, like, a bee sting on her lower eyelid. This is her telling me the story. You told me the story. So, here's the thing. So, I'm always usually last person to walk up to work because, again, I'm showing up 5 minutes before the show.
Yeah. We know.
If that. Sometimes it's 2. So I'm pulling up, and I do, like, from down the hall, you can see that her eye is like, right? So I'm like, damn.
Was she working that day?
She was working.
Oh my gosh.
She came to work, but I think she just didn't want to use a sick day because for all intents and purposes, she was fine. But this is a very, like, an eyesore, like, no pun intended, but it's out there, But she was like, I'm well enough to work. And she's like, she's like, I'm going to go down to the ED anyways and see if I can get some.
So she's trying to thug it out. She's trying to use her nurse card to bypass the ER line. I get it.
And she doesn't want to call in and everything, right? So
Smart.
I could see that shit from down the hall. And I was like, God, do not put me, because we have two sides to our unit.
Yeah.
So you're either on the west side or you're on the east side.
Mm-hmm.
And she's on the west side. I was like, don't put me on the west side.
What's up?
Because a guy like me, bro, I'm going to talk my shit for 12 hours straight. If you want this girl's mental health to be okay today, don't put me on that side, guys. So you never really know what side you're on until you get there. Sure enough, I'm on the west side. Why'd you do this, God? So this thing is huge. Now, I'm busy first thing in the morning, so I'm just like, whatever. I'm not going to bring it up. It is what it is. And I've known this girl since high school. Me and her are super cool. I love her to death. So now, but after like your morning rounds, after breakfast, whatever, I got some time to talk my shit now.
Things slow down now.
So we sit down and I'm like, yo, what happened in your eye? She tells me, oh, bee sting, rah, 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 rah. And I was like, yo, can you do something for me one time? She's like, what? I go matey. She looked at me like, yo, you better stop that shit. She's like, yo, you better stop that. Because her eye was like swollen shut. She looked like a pirate. Man. And then, so we get patients. So this is what happened. I forgot this part. So we have patients that do get eye surgeries as well.
Okay.
So we have eye patches on our unit. So I was like, yo, put this on and go, she's like, yo, you're the fucking worst, bro.
I would have taken it to another level. Put the eye patch on myself.
Oh,
guess who I am for Halloween?
That's what I'm
saying. Oh my god, yo, you should do that.
Oh shit, I'm good at next time.
This episode won't come out. I don't know. So you should do that for Halloween.
Yo, every time I see her, I just have to talk my shit, bro. Oh my god. So yeah, she looked like a pirate, man. I was talking shit, and then eventually I could tell, like, yo,
it was getting
I'm getting to her a little bit, and I was like, yo, you want me to stop? She's like, please stop.
Where she goes to HR.
I was like, all right, I'll stop, man.
HR. Yeah.
I should have hit her with that.
But I wish I was on that unit. It would have been mayhem.
Like, honestly, for like 6 or 7 hours, every time I saw her, I'm doing something. And then eventually I was like, yo, you want me to stop? She was like, yeah. I was like, all right, I'm going to stop.
Oh, that's funny.
That shit had me rolling, bro. Oh, man. You can't have me around, bro.
Bro, that's hilarious. But this goes back to what you're talking about in terms of individuals who don't want to take the initiative and the steps to take care of themselves. So, like you said, I'm at a clinic for MP school, and the amount of middle age, older age, and even younger guys who come in and asking for that blue pill.
Ooh,
if you know, you know. That thang. You know what I mean? Bro, it's like I'm trying to educate them on, like you mentioned, hypertension, cholesterol, losing the weight, exercising more, eating the right things.
Right.
And I'm going on like a 5-minute spiel, explain to them why these things are important to have your soldier salute. You feel me?
Absolutely.
And they're like,
don't wanna
okay,
hear that.
okay. They don't want to hear shit.
Yeah.
After I'm talking, so are you going to give me the blue pill or not?
Give me that damn prescription.
Yeah. I have a meeting with a shorty Friday night. You know what I mean?
I got an appointment.
Yeah, I got an appointment
on Friday.
I got to get things popping.
Absolutely.
I need it ASAP.
Absolutely.
If you ain't going to give it to me, get the doctor.
Absolutely.
So I'm like, wow, this is crazy. So I don't know, man. It just comes down to the point where people, they just want to look for the shortcuts.
Always.
Same thing with like individuals that have diabetes or that are overweight. They want the shortcut. They want that Ozempic.
Absolutely.
They want to.
Yeah, Ozempic's a great indicator.
It's a great example in the indicator. They want the Ozempic before they even actually change their lifestyle.
Absolutely.
Or you have these people that just want to do the bariatric surgery without even attempting to lose pounds. But I don't know. It's frustrating. It's
and
very
here's
frustrating.
the thing. I'm not going to sit here and say, I understand it's very hard for some people. I understand there's a mental aspect to this as well. However, I mean, if you've ever gone through the journey of like losing weight or trying to better your health, you will see that that effort actually improves your mental health.
100%.
It improves your physical health. So it improves your overall well-being, but people don't want to go through that. And when you take these shortcuts like Ozempic or other Manjaro, all these other things that are out there, it doesn't improve that mental aspect. And all of these things come with their own side effects as well.
Oh my God.
You know what I'm saying?
Plenty.
Huge, huge, huge. Like a lot of these weight loss injections come with
GI issues.
horrible GI issues.
Diarrhea, nausea.
Horrible. And obviously this is nothing you're going to see on a commercial. But if you ask somebody about it, the GI problems that come with it are atrocious.
Big time. I even think there's a lady that was on, it wasn't Ozempic. I think maybe it's called Wegovy or
Manjaro, maybe?
nah, maybe Manjaro, but there's one that's called Wegovy or something like that.
That one.
But one of the main side effects, one of them, it's like UTI. So it's like, damn,
Bro.
just to be on that many, and you're getting a UTI every time. Yeah, we got to switch you onto something else.
Yeah.
But then the side effects just keep stacking.
Oh,
You know
absolutely.
what I mean? Damn if you do, damn if you don't. But
Absolutely.
I don't know, man. It's crazy. It's wild.
Yeah, man.
The amount of side effects these
And here's the
meds
thing.
have.
I'm not sitting here saying I'm perfect. I got my own problems here. I got my own problems. I'm just saying, especially when you just don't want to get to a level to where you're seeing us in the hospital.
Right.
You know what I'm saying? And then everything becomes our fault. You feel like we're not doing everything we could do to take care of you, when in fact, a lot of this was avoidable.
Bingo.
You know what I'm saying?
So to the listeners out there, especially the male listeners, everybody actually, go for a physical. Like, when was the last time you actually went for a physical?
my last physical was last year.
So with as healthcare professionals, I feel like we always have to get a physical like once a year. Well, for me, I guess when I was doing travel nursing, I had to just to make sure I was in, tip top shape and everything was good. I guess for you, you're full time. So do you have the tendency of saying, you know what, it's time for a physical, I need to go in?
Not really, truthfully. For me, I usually typically don't go every year just because I feel like I'm still young and don't necessarily need to. However, I'm getting to a point where for sure every year I'm going to need to start checking up. And then it becomes, how do I feel? Like if I haven't gone in a while and I feel like I'm feeling exhausted or run down and there's no reason for it or XYZ, I go get some blood work, see what my levels are looking like, take care of myself that way. Mm-hmm. And then for a full physical, I will try at least once every other year, though.
Okay.
Is my projection.
Because I feel like on average, especially some of my homeboys, like I don't think they've gone for a physical since they were kids.
Yeah.
And the only time they will probably go for a physical is if they get a new job or is if their work tells them to.
Absolutely.
And it shouldn't be like that. You should go once a year at least, max. Get your CMP, see what your electrolytes are looking like, your A1C, which is a 3-month marker on the amount of sugar that's attaching to your red blood cells, and see if you're diabetic. These tests are very important, and they're like the early stages for you to get your life back on track if they're elevated.
Absolutely.
Cholesterol, all that shit matters.
And for us in Canada, man, these things are free.
Oh my God.
They're free.
That's another thing.
Like, why not do it?
Do it. Do it as much as you can.
The government is rinsing you. You better go rinse them too.
Facts.
Like, go get all these things done. It costs nothing.
Utilize it.
And at the end of the day, you know what's going on with your health. You know what I'm saying?
Exactly. And your family's health too, right? So if your mom has a history of hypertension, your dad has a history of cholesterol, you're most likely going to get that as well too if you don't take the necessary steps.
Absolutely.
And a lot of people don't know that if you have, let's say, for example, diabetes, you're most likely susceptible to getting hypertension or high cholesterol. They're like triplets.
Absolutely.
You have one, you're going to get the other two.
Absolutely.
And now kidney function's in play as well too with
Absolutely.
that. So just a little bit of education for y'all out there. Definitely go get a physical.
Yes, sir.
But I guess we'll wrap it up there.
Yes, sir.
That was a good episode right there. Man. That was episode 14, right?
Something like that.
This is episode 14. This is episode 14. Yeah. So make sure y'all like, subscribe, follow us on Instagram, TikTok, YouTube, the whole thing. Tell a friend, tell another friend.
Tell a friend.
Yes, sir. Yes, sir. So that's it. We'll wrap it up there. Next
Absolutely.
episode will be episode 15.
Yes, sir.
Peace.
Peace.